Hey there, and welcome to another Health Essentials podcast. I'm John Horton, your host. It seems we love using cute little phrases to describe the wrinkles time etches on our face. Laugh lines and crow's feet, for instance, or those adorable sounding bunny lines. Funny names, though, don't make age-defining creases a more welcome sight. That's why millions of people a year look to erase their wrinkles through Botox injections, a 10-minute procedure that can make you look 10 years younger. So how does this time machine work? That's what we're going to find out today from Dr. James Zins, Emeritus Chair and Section Head of Cosmetic Surgery at Cleveland Clinic. He's one of the many healthcare experts who visit our weekly podcast to help demystify the world of medicine. So let's get started. After all, we're not getting any younger here, as those wrinkles clearly show. Dr. Zins, thanks for joining us on the podcast today.
Well, John, thanks for having me. Looks like we're going to have some fun.
I think we're going to. And obviously, we're talking about treating facial wrinkles today. And clearly, that's something that bothers a lot of people as they age. Is this just a beauty thing, or is there something deeper going on?
Well, I'll tell you, it's interesting, John. Usually, the maxim in plastic surgery is many effects, many results. With Botox, it's very different. Here it's mini effort, but maximum results. So this is sort of this is really, I think, a divergence from many other treatments that we have. So really, an office procedure, which takes just a few minutes, really can have a very significant effect on appearance. Now, that being said, also we should realize that Botox has hundreds and hundreds of uses. It's not just for wrinkles. I mean, it's used for bladder problems. It's used for migraine headaches. It's used for a wide variety of other issues. The dosage that we use for Botox is extremely small, so the risks involved are really infinitesimal.
Well, we're already just a few minutes into the podcast, and I feel like there's already been a huge amount of information shared. So we are going to learn a lot today.
Right.
So I read where Botox injections, and Botox refers to a specific brand, which is something I learned in looking at this. But these injections rank as the most common cosmetic surgical procedure performed globally. Can you walk us through kind of how this treatment works its magic?
It's very interesting. This, just a little background, is there was actually a dermatology ophthalmology couple from Canada, which back in the 70s, the ophthalmologist's wife was using Botox for what's called blepharospasm, benign blepharospasm, which is an unconscious squinching of the eyes. And her husband, dermatologist, realized, well, maybe if this can affect unconscious blinking of the eyes, maybe this could help wrinkles. So that's really how Botox started being used for wrinkles. Now, also, Botox was used off-label for decades. By that, we mean it was approved for benign blepharospasm, but was being utilized by hundreds of thousands of physicians and surgeons for wrinkles. So it's really very interesting past history.
Well, so with wrinkles, then, how does it work?
Well, very, very interesting. It can get very simple, and it can be very complex. From the simplistic situation, what we do is we're using a drug which actually causes some weakening of the muscle or paralysis of the muscle in very, very low dosage. It actually blocks the neural communication between the nerve and the muscle, causing weakening or paralysis of that muscle. Now, the Botox will travel about 1 centimeter on injection. So you do need to understand the anatomy when you're using the drug to have maximum benefit. Now, that being said, there are other ways to use Botox. For example, in the forehead, brow position can be altered by the use of Botox by weakening depressor muscles and allowing elevator muscles to work unopposed. By that, I mean depressor muscles are the muscles which close your eye. The forehead muscle raises the brow, and those cause the horizontal wrinkles. If we weaken the muscles that close the eye, the brow can then elevate, and that is a very youthful appearance. So there are intricacies of Botox besides just injecting the muscle. Botox can be used, interestingly enough, if it's used for a prolonged period of time, it can actually cause some muscle atrophy, that is, wasting of the muscle. So it's been used in the calves, for example, in patients who have big calves and they want to slim down their calves. Now, that being said, Botox is temporary. So once the treatments have stopped, then the effect goes away.
Now Botox, it's described as a neurotoxin, correct? And it's one of many different brands that are on the market.
Yeah, Botox is really one commercial name. There are others: Myoblock, Dysport, a number of other botulinum toxins. That's a scary term when you hear toxin. But again, John, we're using this in such minute doses that there is no risk from overdosing.
Well, I was going to ask you that because you do hear neurotoxin, and that doesn't sound like something you just want injected in
Sure,
your head.
very.
I mean, it does
Sure.
sound a little scary. Yeah. So, I
Well,
mean, are there any risks with it?
the risks are resulted to inadvertent injection, poor understanding of the anatomy, the muscles of the face, and Botox is predominantly used in the upper face, so around the eyes and the forehead. The muscles are very integrally related. So if we inject the Botox into an unwanted muscle, a muscle that we don't want to inject, we can have some untoward effects. Again, so for example, if we inject the forehead too low, we can actually drop the brow. So the brow looks lower, and that makes patients look older or angry. Similarly, if if we miss a diagnosis, upper eyelid ptosis or drooping of the upper eye, what patients call lazy eye, can be very subtle. If the doctor doesn't realize that the patient has a little bit of a upper eyelid ptosis, drooping of the eye, and it can be subtle, injecting the forehead muscles, which elevate the brow, takes away the compensation. So what I'm saying is, if the eye is droopy, then the patient tends to use the forehead, like I'm doing now, to raise the brow. If you weaken that effort to raise the brow by injecting the forehead, the brow can drop, and the patient, the ptosis looks worse. So again, you need to go to someone who understands the anatomy of the face.
Now, it seems like you kind of started touching on this a little bit, but let's kind of go over some of the most common issues and areas addressed by Botox treatment. And I'm pretty sure I can model a few of those wrinkly areas if you need it too.
I think you look pretty handsome myself, John.
I've got the crow's feet and
Uh,
the lines coming in, so I spend a lot of time laughing. So
So again, if we talk about the most simplistic way, the easiest way, and the most common ways of using Botox, that's to get wrinkles. Probably the most common one is the 11s, the vertical lines between the eyes, right here.
when you look concerned, yeah.
Why are you angry? You look sad. You look angry. So those muscles can be injected, and then that weakens or makes those lines go away. The laugh lines, another very common use of Botox, is to get the laugh lines in the lateral eyelid area. That's another common use. The forehead, horizontal lines in the forehead that we talked about, another common use. But again, injecting those forehead lines, the surgeon, physician's got to be careful, because you can have the untoward effect of inadvertently dropping the brow when that's used. So those are probably the most common uses. Another common use is to get the wrinkles around the mouth, the vertical lines in the upper lip. Another common use, and that can often be combined with a filler, so that we fill the wrinkle and also address the wrinkle with Botox. And then finally, another common use is to get the corners of the mouth to come up. So as you get older, those corners tend to drop a little bit. Mine dropped a little bit. Botox can actually elevate that corner, again, by weakening the depressor. So the muscle that pulls down the lip is weakened, allowing the elevators to work relatively unopposed. So those are probably the most common uses. Other uses, you can use it to shrink or make the masseter muscle not as prominent. Very common in Asian patients, called benign masseteric hypertrophy. So that muscle or the very wide face, lower face, can be slimmed down by injections of Botox. So lots and lots of uses. As I said, that just touches it. There are hundreds and hundreds of other applications of Botox, medical indications, headache, bladder problems, TMJ problems, just hundreds and hundreds of uses.
Wow. And everyone just focuses on the kind of the cosmetic ones.
Well, that's sure. Yeah. So I think what you do when you think about Botox, there are the cosmetic uses, and then there's the medical uses.
So when you get the cosmetic treatment, like what happens afterwards? I mean, is there a long recovery? I mean, you talk about, kind of paralysis of the muscles. You feel like there might be a little bit of some time that you need to recover there, but is it as quick as the procedure?
Yeah, again, we say mini effect, mini result. This, again, minimal effort, maximum result. It really is just a very fine needle stick that we do in the office, which just takes minutes, and there's basically no recovery. The side effects that can happen are really quite mild, but patients should be aware, especially in the laugh line area where the skin is very vascular. You can get a bruise. There can be a little bit of discomfort. Occasionally, patients get headache. Headache is a very multifactorial thing, but some patients report headaches after Botox injection. But these effects are mild. And again, the one thing that I mentioned earlier is, again, if inadvertent injection into a muscle we don't want to inject, we can get some untoward effects that I mentioned before.
Now, I as somebody who doesn't like needles, I noticed you said a very fine needle. Like, are we talking, is it like a flu shot needle or like less than that? Is it that hair thin?
Well, what we do is we really try to, if you hurt the patient, they're not going to come back. So we do everything we can to minimize discomfort. And there are a number of things that we can do. You can use an ice to reduce the discomfort. I use a spray called Pain Ease, which we spray on the area before we inject the patient, so that the needle discomfort is really minimized. That, and there's also topical medicines we can rub on, and to lead to anesthesia. So really, the discomfort is really minimal, and the needle is finer than a flu shot needle.
Okay, well, that's good to know. As anyone who has listened to this podcast knows, I am a very big baby when it comes to anything like that. So I always ask the question. So if you come in and you get a Botox treatment, how long can you expect this kind of magic spell to last?
Well, the Botox, it's not like the faucet. You turn it on and you turn it off. You will gradually lose the effect, and it lasts approximately 3 to 4 months. So again, it's temporary. Also, if there's any adverse effect, you realize that's temporary as well. So again, 3 to 4 months. So patients do have to return to maintain the effect. The other thing to realize is with repeated injections, it's interesting. I don't know if it's behavior modification or if it's actually atrophy of the muscle. But with repeated injections, I find that patients really don't frown as much. So, and why that is, I'm not exactly sure. But you sort of break that. I think you break that habit by behavior modification.
That's an interesting bit of insight there. Now, when you say you can come back for it, so if it lasts a few months, can you just keep coming back every couple months and kind of erasing those lines?
Sure. Yeah. Again, I find that patients are usually coming back. They're not coming back periodically at 3 months, but they'll come back at 4 months, 6 months for a second injection. There's really no downside to doing that. Again, perhaps what we will see is atrophy of that muscle, so that time sequence maybe even lasts a little bit longer.
Now I read where I know most people view Botox as a way to kind of resolve wrinkles, but I read where it's also being used as a preventative tool. How does that work?
Well, again, I think that's more theoretic than operational. But the concept there is that what we're doing is, one, maybe breaking the habit of frowning. That may be one issue, and also of training that muscle, weakening that muscle, or making that muscle atrophy, so it's not as active. Again, I think more of a theoretic thing. I don't think we have hard data to support to support that. But I think it's a reasonable assumption.
Well, it's a good thing I'm always smiling doing these podcasts, because then I don't think I'm going to have to come in and get that frown taken care of anytime soon. When you look at people coming in, are there some folks who are good candidates for Botox?
Absolutely. So I think that, again, like everything else, the older we get, the more difficult it becomes to rejuvenate the face, to make the face look younger. So those patients that come in, they're 70 years old and they have excess skin, and that frown is deeply ingrained in their skin. Those patients are not going to respond as well as someone whose frown is present only with action. So that patient who comes in where the frown is deep can best be handled by a combination of Botox and a filler. So we're going to inject a filler in that area, a synthetic filler, to plump up the skin as well as to weaken the muscle. And then so those patients will definitely need additional treatment besides Botox alone. So the older the individual, I think the more difficult the problem. The younger the individual, once the problem is present, the most effective. So I would say the patient between about 30 and maybe up to 55, 60 are ideal patients.
Okay, well, it sounds like I'm right in the zone now.
You're right there. We'll line you right up. Okay, I actually have a bottle here. We can do this right after.
But if you are interested in Botox, kind of what should you do? What's the process to follow?
Well, I think you see your doctor, your plastic surgeon, your dermatologist, and like everything else, going to someone who does an awful lot of it, you tend to get the best results. So, query the doctor or friends who've gone to other doctors who've had good experience. But I would stick with the so-called core specialties, plastic surgery, dermatology, rather than going to internist, general practitioner, or gynecologist. We tend to have been trained not only in Botox, but also alternatives to Botox. Like I mentioned, certain patients really aren't going to benefit or need combination therapy.
All right. Well, we've covered a lot of info here, Dr. Zins. But before we part ways, is there anything else you'd like to add for someone who's considering Botox treatments?
Visiting a doctor, talking to the doctor about it, perhaps, if you have concerns or if you're hesitant, then just going in and just having a consultation rather than planning on having Botox injected, and speak with the doctor, answer the questions, answer the concerns, make sure you're comfortable before you have the procedure. But again, this is a procedure where the risk is quite low.
Always good to hear. So I'm going to take a little closer look at some of these lines, and maybe we'll be talking again here soon.
Sounds good, John. Thanks very much. It was a pleasure talking with you.
Thank you. Millions of people a year turn to Botox treatments to smooth out wrinkles and get a more youthful appearance. Know this going in, though. It's a temporary fix, not a permanent return to youth. If you liked what you heard today, please hit the subscribe button and leave a comment to share your thoughts. Till next time, be well.